Mhm. Awareness. We can start using it for podcasts too. I use the Google.
Okay, there we go. We're live on YouTube. So, hey, welcome, BrainTap Nation. We have a couple of special guests here that they just informed me of this product yesterday. I was blown away. I said, hey, we need to get this live out to all of our BrainTap offices. And then they said, hey, wait a minute, even a house could use this. Everyone out there can get this for their home. So, Dr. Zelk, why don't you tell us a little bit about what we're talking about there? And Dr. Russ Kort's there beside you.
Yeah, so I am a sleep specialist in Portland, Oregon. I'm also a dental device manufacturer. So I interact and train dentists in a therapy called obstructive sleep apnea treatment with oral appliances. And I want to find solutions out there to help them comfortably get back to practice, keep their staff safe, keep their patients safe, reduce the risk for contamination. And that's become a real big topic right now. And instead of everyone running out and grabbing a bunch of quaternary ammonias and pretty gnarly disinfectants, I've been doing a research on both ozone as well as biomimicry type of cleaners. And this one cleaner come up, it's really taken me by surprise. I've been really impressed with it. It's called hypochlorous acid. It's what your white blood cells use to attack all human pathogens. We're talking viruses, bacteria, molds, mold spores. It's also been shown to destroy prions. So that's the only disinfectant that destroys prions. And what I was very, very impressed with hypochlorous acid is it's 80 to 100 times stronger than bleach as far as a disinfectant, but it does not hurt human beings because we make it. And so since it's biomimicry, it's literally taking advantage of your body's innate immune system. And since it acknowledges that it doesn't cause more problems, it actually enhances your recovery response. So we've been looking, scouring the areas for reputable manufacturers of this. And the reason why, even though it's been around over 100 years, like ozone, it was never shelf stable. It was such a powerful oxidizer that you couldn't get it to stay in place. It would just use itself up. So these guys were able to find a way to make it shelf stable. So now we can use it as clinicians, both in our facilities as well as at home. I can tell you, I'm already misting this at home, and I've got it on every squirt bottle I can find right now, regular tap water. And I've given demonstrations before where you can actually spray it on your hands. You would never leave bleach on your hands, but this stuff's totally safe. So the one manufacturer I've been really impressed with is called Top and Health. And this is kind of the product that they market to dental offices. It's essentially a series of tablets. Very simple. You put one tablet in 2 gallons of water. It makes 530 parts per million, which will kill all bacteria, viruses, and mold. And again, safe to breathe. I don't know if Russ wants to grab the humidifier.
We can't hear you.
Yeah. I said, this is how this all came down, was that I called Joe and I said, Joe, I have not been practicing in the last month. I have got to get back into practice. You got any ideas? And he's like, oh my gosh, Russ, I got this great idea. And so he started telling me about the dolphin pods and how the hypochlorous acid could work in my practice. So yesterday we came and we did a couple of videos, and this is what's really crazy. You know, Dr. EMF, that hypersensitivity runs in me, and I'm hypersensitive to chemicals as well as EMF. Well,
You're cutting out, so I don't know where the mic is, but you need to step closer to it.
okay, sorry. This stuff is this is actually a humidifier that I have, okay, and it's got hypochlorous acid coming out of it. This, Joe's going to explain how this helps to clean the room, safe for our offices, safe for us to have at our front desk, safe for us to have in our homes, and it's purifying the environment. Now, remember what I said. I am highly chemical hypersensitive, sensitive to flowers, sensitive to perfume, sensitive to the chemicals in the grocery store. I know you can see how close I am to this. Yesterday, I talked in front of it for an hour. And I had no problems with it. I even put it on my hair.
Mhm.
Right,
And right here, you put my
For some reason, you're cutting out. Sorry.
Oh, this is way more effective than washing your hands. I can put my hand on this or squirt this stuff on my hand, and I'll have a lower colony forming unit count on my hands than I would if I washed my hands for 20 seconds. So this is super important. It's a new technology. It's now available to clinicians who are focused on both wanting to practice the highest level of disinfection, but also trying to keep their family safe, them safe, without being exposed to noxious chemicals that are currently being used. And even though there's a litany of research on this, it's only recent that it's been able to be accessible and scalable for clinicians. So I'm taking this message that I've been training dentists on managing their aerosol disinfection, their surface disinfection, their waterline disinfection, and I'm applying that same technology to other clinicians who want to be back into practice safely. But again, these are people that are taking care of folks who are highly sensitive to things, and you have to be very discerning on what you bring into your practice. Otherwise, you might trigger the cell danger response or overburden the allostatic load in someone who's already got challenges with health status. And so someone who's already been laden with mold exposure or chemical sensitivity or chronic fatigue or co-infection or Lyme disease, these folks cannot handle a lot of extraneous sort of toxic products. They have to be dealing with something that the body sees as its natural element for treatment. I've been really excited because it almost sounds too good to be true. And I thought so when I first started doing this. I would never, ever breathe ozone. And ozone, I was so excited. You can put it in water and you can clean surfaces. You can clean your vegetables, your fruits and whatnot. It's a very effective oxidizing treatment, but you cannot breathe it in. So you can't use it effectively on a daily basis. So hypochlorous is essentially a cousin, an oxidizer to the ozone molecule that your body's used to using. Now, what really tripped me out was hypochlorous is the initiating process for healing. So if your white blood cell goes to an injury and with the oxidative burst is what they call it, they exert energy, they blow away the pathogens with this hypochlorous. Then it sets a stage for downstream effects for the body to start healing things, right? So the actual wounds that start to develop actually heal faster when you apply hypochlorous. So instead of worrying about the disinfectant causing a problem, you accelerate the natural healing response, which it's really been impressive to me. So I've been really excited to share the message basically. I was talking to Russ because he's introduced me to BrainTap. And by the way, I'm not trying to puff you up too much, but my wife doesn't really deal with anything I bring her to the house, but she's been very happy with BrainTap. It's really impressive. I'm not kidding, man, especially right now. So he was saying, well, Joe, how do I clean this thing? Well, I already do UV light for cleaning things, but that's kind of bulky and clunky, and it's not used for several other applications. So I said, just take the hypochlorous, spray it with a light mister onto a washcloth or some sort of micro towel, or you can do it gently onto the BrainTap, wipe it off, and then it's fully sterilized within 15 seconds.
Wouldn't we be able to take that and put it in front of the mist here from the dehumidifier and do the same thing?
You're absolutely right. Humidifier, and at this level, I put in 500 parts per million. That's going to kill anything. If you just wave it in front of the port here, there's a port right off the screen here. This little port right there. If you just wave it in front of there for about 15 seconds, you just expose it to 500 parts per million, which will kill any pathogen. If you were to expose it out here, it would dissipate a little bit, about 200 parts per million, and I could easily breathe that directly in. I would never do this with chlorine, but actually I can breathe this in, and it's actually improve the health of my nasal passages. So if I have like a little chronic infection or a little allergy, I can actually pull that in, and actually it's made to improve skin as well as any cuts or little acne. You can actually kind of wave that against your face, and it's actually a little treatment. There's just way too many applications that we haven't really explored yet because it's just so brand new.
Right. So they can go to sleeprd.net Is that where they can go to find out about this product, and they can put in Dr. EMF and they can get a discount? And then please leave any comments in the below section if you have any questions for them. But I have a couple questions for you too.
Yeah.
So with the device that you have right there that Dr. Kort's sitting in front of, and it's misting him, how far does that reach? I mean, what do you need one of those in every room of your office, or what do you recommend somebody get to really disinfect their space?
Well, what I'm doing is I do low risk treatments. You know, I do these little oral appliances. I'm not aerosolizing. Even if someone's doing manipulations and whatnot, you can have this kind of going. It's going to cover probably about a 5 to 6 feet in square feet there. You're going to want to basically mist up the whole area. Make sure all your surfaces are saturated. Having some sort of HEPA filter, UV, in that same patient room would be helpful to kind of clear things. But you want good air movement, and this is a benefit. But really, if you seriously want to take care of disinfection for a clinician, you'd want to actually add something as far as an ionization to the forced air as well, which is a whole nother thing we've been talking about with our dental practices. But this is kind of a good precursor. It's better than doing what we're doing right now, which is nothing.
For good, better, best though. I mean, if you had the humidifier in your office, say you had it in your treatment room, you had the door closed when you weren't seeing patients. Patients come in, they see this, they go, what is this? And it's like, oh, just put your hands like this. Let's clean our hands. You know, we spray down the tables with this. We use this on the headset. Because the room is closed, there's going to be an ambient effect, just like in a child's room. When you use this in a child's room for, you know, when they have a cold or so forth, this is going to have that kind of an ambient effect in your office while you have the door closed. And it's certainly much better than what we have available to us using the wipes and the Clorox.
Right now,
You need to step closer to the mic for some reason.
this is better than what's being done currently.
It's still not getting it. Sorry.
So, how are we doing? Any better?
I don't know what's happening. You went silent.
It went silent. Yeah, any better?
It's a little better, but it was coming in strong. I don't know what happened.
Yeah, it could be the connection there.
Yeah, that's good.
Yeah. So, I kind of
This in the room,
Yeah.
with the door closed, better than what we have.
Yeah, so thanks for that reminder. We've developed, and it's not ready yet, but we actually have a fogger that makes the same sort of 5-micron disc that can blow across all of your surfaces in the room in between patients, which would be just as effective to add to this. That's in development. Everything's happening so quickly that if someone was to go to sleeprd.net and go to full office disinfection and put in Dr. EMF and say, hey, I'm interested in a fogger, then we can put them on as a pre-order, at least for some information to get back to them. As soon as it's available, you can hook that up to a bottle like this with a little bit of compressed air, and you can silently fog the whole room. And in 2 minutes, you've got a fully sterilized facility there.
Okay. How do you recommend they do it in their homes? If they're doing it in a home instead of an office environment?
Yeah, so the home is probably more appropriate. They actually come with their own bottles. They're back ordered, so I just use something from Lowe's here. But essentially, you mix it, put it in a bottle, and you put it on mist, and you just squirt down surfaces as needed. You know, you can use this to clean poultry, vegetables. You can squirt it on your kids' hands. Yeah. You can, because a lot of kids, they don't get in there and wash their hands for 20 seconds. A couple squirts in the hand, rub it in. You saw that on the video yesterday, and no worries. It's not going to hurt the skin. It won't hurt the child. I just was talking to someone. They said my kids, running around all over the place, getting scraped up. I said this is perfectly acceptable at 400 parts per million to squirt onto the cut. It's going to help it clog off. It'll clean and disinfect it, and it will rapidly accelerate the healing. If you do this 3 times a day, the data shows that you can ramp up healing by up to 4 to 5 times standard care. So that's pretty impressive. You're tapping into your body's natural potential to heal.
That's great.
totally safe for dogs and cats. And I would highly recommend spraying their fur, because the first thing you do when you're out on a walk, social distancing, is you'll see some stranger coming up and petting on you. And you want to make sure that you're not catching their off of them. If probably don't have it, but.
Okay. Well, anything else you think we need to know about this product before we sign off for today? I mean, this is great information. I think every office, this is a very affordable solution. I know that there are cleaners you can buy for, thousands of dollars that you get installed in your space, and they'll, you don't need a clean room like a hospital operating room or something. So what other information can you share, or do you want to reinforce something you've already mentioned?
Yeah, so what I would suggest folks do is go, the simplest thing is to go grab.
Oh, you just went silent. I'm sorry. So say it again into the camera. The camera's in the middle of the,
Yeah. The box, that box is about a year's worth of cleaner for a commercial facility. So anyone could, that would last them for a long, long time. And that's only hundreds of dollars for a year's worth of cleaner. And we can, pretty soon, these guys, they're commercial, they're gonna have some consumer grade stuff, which is nasal rinse for sinus stuff, oral rinse for sore throats, gel for sore gums. There's going to be a lot of commercial consumer products coming up that we'll keep you up to date on.
That's great. All right. Well, they're going to go to sleeprd.net. That's sleeprd.net. They're going to put in Dr. EMF, all one word, and they're going to get a discount on this product. So go there, rush there right now, put that code in, get your discount, like I'm going to do right after we get off this call. Get some sent to your home or to your office. If you're not at your office right now, get it sent to your home. Then you can go down to your office next time, start disinfecting it. So when you do go back in, or even your store, if you happen to be running a market or a place that's open right now, this could be something they could be using right now. I mean, on their surfaces, I see them cleaning their carts with Clorox, and when you walk in the grocery store, they could be using this product and things of that nature. So it doesn't hurt the surface if it's resting on there. You got to wipe it off right away.
Not at all. Not at all. You want to leave it on there because the byproduct is salt and water.
Okay. All right.
So super safe. I actually bring a little squirt bottle, little travel squirt bottle with me. I spray everything down when I leave a place. I spray my hands. It's totally safe for human beings, but totally lethal for pathogens. I have an ENT office that wants us to get them squared away with this with a fogger to do disinfection, because the alternative is no treatment.
This is great. Well, this will be something that we travel with BrainTap, because when we're on the road, we're always bringing cleaners with us, and people are questioning it. So this is something we can share with them and show them we're cleaning off because we have to clean it in between uses, even before this COVID thing. People don't want to be putting on headsets that. Now, how long do you find it stays on the surface? Like I think Dr. Kort said something about that earlier, but I think it got washed out. So if you spray the surface, when do you have to come back and re-sanitize?
It depends on what exposure you've had. So if it's an area with not a lot of foot traffic, it'll stay on there for hours. It's very rapid and very prolonged in its duration. But again, once it actually does its work and it interacts with that pathogen, byproduct salt and water. So even if there's hypochlorous acid active on the surface, it's safe for humans and lethal for pathogens.
That's great.
Fun.
So there you have it from Dr. Joseph Zelk, who's found this product that we can all use to disinfect our offices and our homes and keep us safe. And you can use something as easy as a vaporizer or a humidifier that people probably already have right now sitting somewhere in a closet that they only bring out when somebody needs Vicks Vapor Rub or something. So you can put that thing to work the other time. And right now, like Dr. Kort said, you can put it by your door if you want. And when people come in, or family members, they can clean their hands and even put their face in it and do it. So I think that's a great solution. So anything you want to leave us with, Dr. Kort, before we?
I do. I just want to say one more time. So Dr. Zelk, it's one tablet in 2 gallons of water.
2 gallons. I'll give you 535 million. That's perfect for anyone's facility.
Okay, so they can go to the site. Again, the site is, I'm going to put it in the comment section. So if you're listening to this on the road, you're going to have to go back to the website if you can't get this down, but it's pretty simple, sleeprd.net. So it's sleeprd.net, and you're going to put in the code Doctor, spelled out DOCTOREMF, Dr. EMF. And then they're going to give you a discount on this product. So run, don't walk, get on the internet. Let's go to that page. Let's all order this and start disinfecting our homes. And you can probably even use it in your cars if you're wondering. So any surface that you put your hands on, you can use this product, and it's so affordable. You can carry around a little spray bottle like Dr. Zelk was talking about, and you can have that with you. So if you go somewhere and you're worried about it, spray your hands down, spray your surface that you're going to be touching, and let's all be safe during this time. So thank you both for taking time out from your sunshiny schedule in Portland. I know when I was there, it was really sunny and nice. So Dr. Kort said that's not it. That was not the right weather. When I got there, it was a different Portland. But
That's right. He
was
brought
really-
the sun with him.
yeah, it was very beautiful. So again, thank you both. And I hope that people will like, share, and promote this product because it's a very affordable product. You can buy it direct from sleeprd.net, putting in the code Dr. EMF, and then share it with your family, your friends, anyone that you want to survive this with really good health. So the others don't worry about it so much, but share it with everyone else. You think you can share this video on your Facebook pages. You can share it on your Instagram, share it wherever you think is appropriate so that we can have a simple solution to clean this virus so we can all be safe. So again, once again, thank you for your time. Appreciate you both. And we'll talk soon. Thank you.
Thank
Thanks,
you,
Dr.
Doc.